Hello, and a very warm welcome. I am so glad that we can share this time together today for a conversation about a topic that is incredibly common, yet so often goes unspoken. It's a quiet, frustrating, and sometimes embarrassing issue that affects millions of people, especially as we journey past the age of 50. We are going to talk about the challenge of completely emptying your bladder. Perhaps this sounds familiar to you. It's that lingering feeling after you've used the restroom that you're not quite finished. It's the frustrating need to go again just a few minutes after you've already gone. It's the anxiety that comes with always needing to know where the nearest restroom is, a habit some people call toilet mapping. For many, it's a problem that disrupts the most precious thing of all, our sleep, forcing us to get up multiple times a night, leaving us feeling exhausted and drained in the morning. This issue, which doctors sometimes call urinary retention or incomplete voiding, can have a profound impact on our quality of life. It can make us hesitant to go on long car rides, to sit through a movie at the theater, or to simply enjoy a day out with our families without that nagging worry in the back of our minds. I want to start by saying, if you are dealing with this, you are not alone. This is not something to be ashamed of, and it is certainly not something you just have to live with. The purpose of our conversation today is to move from that place of frustration to a place of empowerment. So often we think the solution must be a complicated medication or an invasive procedure. But what if I told you that for many people, the path to better bladder control and more complete emptying can begin with a few simple, gentle, and incredibly effective exercises and techniques that you can do right in the privacy of your own home? Today we are going to walk through a step-by-step guide to 4 of these powerful techniques. This is not about a quick fix, but about retraining your body, about learning to work with your body's brilliant design, not against it. This is about giving you a toolkit of strategies that can help you regain that sense of comfort, confidence, and control. Before we dive in, I would be so grateful if you would share in the comments. Is this a topic you've ever felt comfortable discussing with anyone? Just a simple yes or no can help to break the silence and remind us all that we are in this together. And if you find this conversation helpful, please consider subscribing. We are here to provide supportive, encouraging, and clear information for your health journey. First, to understand why these exercises work so well, let's have a gentle look at the beautiful mechanics of how our bladder functions. Think of your bladder as a muscular balloon, what's called the detrusor muscle. Below it, you have a brilliant hammock of muscles called the pelvic floor, which acts as a support system and contains the sphincter muscles that act like a gate. For you to empty your bladder completely, 2 things need to happen in perfect coordination. The balloon, or the bladder muscle, needs to give a good, strong, sustained squeeze. At the exact same time, the gate, or the pelvic floor muscles, needs to completely relax and open up, allowing the urine to flow out freely and without obstruction. As we age, a couple of things can happen. For some, the squeeze of the bladder muscle can become a little weaker. But for a huge number of people, both men and women, the primary problem is with the gate. Due to a lifetime of stress, poor posture, or even a misunderstanding of how our bodies work, the pelvic floor muscles can become overly tight or hypertonic. A tight muscle is a weak and uncoordinated muscle. It doesn't know how to fully let go. So even when your bladder is squeezing, if that gate doesn't open all the way, you'll be left with that frustrating feeling of being incomplete. Our goal with these exercises is to teach that gate how to fully and completely relax. Let's begin our journey with our very first exercise. And it might surprise you that it has nothing to do with your pelvis at all. Our journey begins with the muscle that controls everything else, your breath. We are going to learn diaphragmatic breathing, or belly breathing. Here's why this is the essential first step. Your primary breathing muscle is your diaphragm, a big dome-shaped muscle that sits at the base of your ribs. Your pelvic floor is the muscular dome at the base of your pelvis. These 2 domes are designed to work together like a piston. When you inhale correctly, your diaphragm moves down, and your pelvic floor should gently descend and relax with it. When you exhale, your diaphragm moves up, and your pelvic floor gently rises. But most of us in our busy, stressed-out American lives are shallow, chest breathers. We hardly use our diaphragm at all. This creates chronic tension in our shoulders, our neck, and, you guessed it, our pelvic floor. A tight and tense upper body leads to a tight and tense lower body. By learning to breathe with your diaphragm, you are sending a powerful, direct signal to your pelvic floor to let go of its tension. Here's how to do it. Find a comfortable seated or lying position. Place one hand on your chest and the other on your belly, just below your rib cage. Now, take a gentle breath in through your nose, and as you do, I want you to actively try to send the breath down into your belly so that the hand on your belly rises. The hand on your chest should stay relatively still. Then, as you slowly exhale through your mouth, feel your belly gently fall. Let's try that again. Inhale, the belly expands like a balloon. Exhale, the belly softens. I want you to practice this for 2 to 3 minutes a day. But the most important time to use this is right before and even during urination. Sitting on the toilet, before you try to go, take 3 to 5 of these deep, calming belly breaths. This will relax your entire nervous system and, most importantly, will send that direct signal to your pelvic floor muscles, telling them it's safe to relax and open up. This leads us perfectly to our second exercise, which is the direct skill of relaxing that gate. This is what's often called a pelvic floor drop, or a reverse Kegel. For years, the only advice we ever heard was to do Kegels, to squeeze and tighten. And while that is important for preventing leakage, it does absolutely nothing to help you empty. In fact, if your muscles are already too tight, doing more squeezing can make the problem worse. To empty your bladder, you must learn to do the exact opposite. You must learn to release, to lengthen, and to let go. This can be a tricky sensation to find at first, because it's so subtle. Let's try to find it together. Sitting comfortably, take one of those deep belly breaths we just learned. As you exhale slowly, I want you to imagine your pelvic floor muscles, the area between your sit bones, gently melting, softening, and widening. Imagine the feeling of a gentle sigh of relief spreading through your entire pelvic region. Another cue that can be helpful for both men and women is to imagine a gentle bulging sensation, as if you are about to pass gas, but without any straining. It's a very slight downward and outward movement. There should be no pushing or straining from your abdominal muscles. It's a pure release. The best time to practice this is on the toilet. After you've done your diaphragmatic breathing to relax as you begin to urinate, consciously think about that drop or release sensation. Let the pelvic floor go completely slack and allow the stream to flow without pushing. This coordination of a relaxed pelvic floor is the key to a complete and satisfying empty. Now, even with these relaxation techniques, sometimes the bladder just doesn't get everything out on the first try. This brings us to our third strategy, which is a simple and incredibly effective behavioral technique recommended by urologists everywhere. It is called double voiding. This is exactly what it sounds like. After you have finished urinating, and you think you are empty, don't just stand up and leave. Instead, stay on the toilet and relax for about 20 to 30 seconds. You can take a few more of those deep belly breaths. You can try gently rocking your pelvis back and forth a few times. Then lean forward slightly and try to go again. You may be shocked to find that a second, smaller stream of urine is released. Why does this work? Sometimes a small amount of urine can get trapped in the urethra. Or if the bladder muscle is a little weak, it might not have fully squeezed everything out on the first attempt. By waiting and changing your position slightly, you give the bladder a second chance to finish the job. Making this a regular habit, especially before you go to bed at night, can dramatically reduce the need to get up again an hour later. It is a simple trick, but for many, it is an absolute game changer. Finally, we arrive at our fourth and final technique. This one has to do not with what you do with your muscles, but with the very position your body is in when you use the restroom. We are going to talk about correct toilet posture and the magic of a simple footstool. The modern Western toilet, while convenient, puts our body in a position that is not ideal for complete elimination. When we sit with our feet flat on the floor, our hips are at a 90-degree angle. This position can cause a natural kink in the urethra, the tube that urine passes through, and it keeps a key pelvic muscle, the puborectalis, partially engaged. This makes it harder for both the bladder and the bowels to empty completely. The solution is remarkably simple. We need to get our knees higher than our hips to mimic a more natural squatting posture. The easiest way to do this is by placing a small footstool in front of your toilet. You may have seen products like the Squatty Potty advertised in the US, but any stable stool that is about 7 to 9 inches high will do the job perfectly. When you sit on the toilet, place your feet on the stool and then lean forward slightly with your back straight, resting your forearms on your thighs. This position instantly changes the angle of your pelvis. It relaxes that puborectalis muscle, and it straightens out the pathway for urine to flow. It unkinks the hose. You will likely find that with this simple change in posture, your stream is stronger, and you are able to empty your bladder and your bowels more quickly and, most importantly, more completely without any straining. So there we have our 4 powerful strategies. Diaphragmatic breathing to relax the entire system. The pelvic floor drop to consciously open the gate. Double voiding to ensure you finish the job. And the correct toilet posture to optimize your body's natural mechanics. My deepest hope is that this conversation has replaced any feelings of embarrassment or frustration with a sense of clarity and empowerment. You do not have to live with the anxiety of an uncooperative bladder. You have a toolkit of simple, gentle, and effective strategies that you can begin to use today. Please remember, this information is for educational purposes and is designed to empower you on your health journey. It is not a substitute for professional medical advice. If you have persistent urinary issues, if you experience any pain, or if you are a man and are concerned that your symptoms may be related to an enlarged prostate, it is absolutely essential that you see a doctor or a pelvic floor physical therapist. They can give you a proper diagnosis and create a personalized plan that is perfect for you. The journey to better bladder health starts with understanding, with gentleness, and with consistency. Be patient with your body as you learn these new skills. You are building a new, more cooperative relationship with it. One breath, one release, and one comfortable trip to the restroom at a time. Here's to your health, your comfort, and your confidence. Take wonderful care.